Welcome to Healthy Mind, Better Future, a podcast dedicated to mental wellness. We are all challenged by psychosocial struggles. Families are broken, jobs are unfulfilling, neighborhoods are unsafe. Poverty and illnesses deter us from quality of life. We're stressed, anxious, and in despair. Healthy Mind, Better Future brings awareness and relief to those with mental health challenges. It offers practical tips for managing stress and anxiety so you can positively function in society. Our podcast panelists are Dr. Adeyemi Fatoki, a board-certified family medicine and addiction specialist, Dr. Olaleye, a board-certified pediatrician and primary care physician, Dr. Kenneth Soyemi, a board-certified pediatrician and general preventive medicine physician. I'm Funmi Onayemi, your host. Dr. Fatoki, what is mental unwellness?
The way I would look at it, it's a state of mind, mental wellness is a state of mind and a state of well-being. That's when your body, mind, and soul and everything is working in unison like it should. You are able to handle stress. You are able to be mindful of things that are going on, and you're able to maintain a healthy lifestyle. It's similar to being able to exercise and remain physically well. So we have to look at the mind and the brain needing the same kind of exercise to remain mentally well.
Dr. Olaleye, I know that you deal with children. And so the question is, what are the signs of mental unwellness with children?
Children can present the same way as adults or sometimes differently. But most of the time it is by presenting with somatic symptoms. Things like chest pain, abdominal pain, headaches, physical symptoms. But sometimes they do have mental symptoms like anxiety that is visible to everybody, or the depression or panic attacks and things like that.
So, Dr. Soyemi, when mental unwellness is unchecked, especially in teenagers, what will be the consequence of such?
It depends on the environment, and I'm gonna piggyback to what Dr. Fatoki said. I personally believe mental wellness is crucial because it affects every aspect of our life, from how we think to how we manage stress and how we build relationships. So you can now imagine a little young kid who is going through all sorts of stresses in his environment. It's definitely going to affect the way he builds relationships. It's going to start getting into trouble. And the back end is what we see in the juvenile correctional system when they end up in our system.
The interesting thing about the world today is that most of us don't even really understand the whole idea of having to keep ourselves mentally well. Because we don't understand that, we know that we have barriers that actually interferes with controlling our wellness. So what are some of those barriers, if you have to think of some?
There are different barriers. Sometimes it's the stigma that is associated with mental illness. Sometimes it has to do with access to getting help. Sometimes it has to do with finances, the cost of getting to pay for the service, even when you have insurance, or sometimes uninsured people. And sometimes it's just misinformation, period. People they don't have the correct informations. They have the wrong idea of what is mental illness, misconception.
And those misconceptions have gone very far. Some of them are actually cultural barriers, cultural beliefs that we have as barriers for sure. Would you have, or have you ever seen a patient whose parents came in with concerns about their child, and then they came also with misconceptions about mental wellness?
It happens frequently. That sometimes people do not want the diagnosis of any kind of mental illness because of their cultural background or what they believe, which is a misconception of what they believe mental illness is. And they go like, I don't want him to be labeled with mental illness. No, there is nothing wrong with him. We can put it in prayer. Oh, she's fine. I don't know what, she's just looking for attention. So people come up with denial or excuses for the symptoms, or outright they just don't believe it, or they're afraid to acknowledge what, even though if they're true to themselves, they know it's there, but they feel like if you don't agree with it, well, maybe it will disappear somehow.
Sometimes people have a hard time finding someone who speaks their language. Immigrants are concerned that they go for counseling or they seek mental health. It might show up when they apply to change their status, and that might be a reason for them to be deported. Finding someone who speaks your language and understands your language is a possible barrier. And some of the misconceptions include our beliefs, especially we African descendants, that some of the mental unwellness or issues we are having are spiritual. And rather than seeking the proper care, they may just feel they can deal with it through prayer or fasting and things like that.
So as we lead into this particular subject matter, starting with this episode, you've been coming up with this casual way of looking at mental health. You've been coming up with ways in which we can navigate around and manage our mental wellness. So give us a few tips about what you think or what we need to do to help us navigate this particular subject.
A stigma and social perception is one of these, is the most significant barriers. And I'll give you an example. I saw a friend of mine, we grew up together about 40, 50 years ago. Then he was telling me about when I left Nigeria, he was still back home, about the properties and everything, all the stuff he went through and all the domestic violence he watched his mother experience. Then I looked at him, I'm like, did you get counseling? Then he looked at me, I'm like, what do you mean by counseling? So those are the kind of, I'm like, oh boy, you really need to go into counseling and get therapy. But I could tell he was not convinced by what I told him, and it was actually a shock to him. Then I was like, wow. So people, you can build up all these memories, all these bad memories, go about your life and think you don't need therapy, and that's where I disagree with him. And when I came back, I sent him a message. I'm like, hey, I know you disagree with what I said, but consider going into therapy with all those issues that me and you discussed. So yes, so the social perception and like the cultural, like therapy care. What do I want to be doing with therapy? Those are that's one of the most significant barriers. Limited access to mental health, and I think Dr. Olaleye mentioned that economic barriers could also be issues, lack of awareness and education, just like my friend, shortage of mental health professionals, systematic and policy issues. All those could be issues that could be barriers. And one of these days, like we have telehealth, and not everybody has access to super smartphones like some of us do. There are also issues about privacy concerns, just like Dr. Fatoki mentioned regarding immigrants not wanting to get their business out there and the fear of deportation.
I came here when I was very young. I was 18 years old. And there was a time when I couldn't afford to pay my school fees, and I got very depressed and almost to the point of even trying to commit suicide. But I had no one to talk to. I was here, my parents were in Nigeria, my siblings were not here. And it was just something embarrassing that I couldn't discuss with anyone. When I was in medical school, I was going through something similar. And that's when actually what I did, there was a psychiatrist that I was working with during my psychiatry rotation. And that's who I spoke to. So that was who treated me, but he wasn't writing notes, and he was more or less treating me, but at the same time, he was my mentor and my teacher, and that's when it became easier for me to accept that, this isn't a failing and there's nothing wrong with getting counseling. Because actually, a lot of times what the psychiatrist would ask me when I told him what I was going through, He'll tell me, okay, you are the doctor. You tell me what you're going to do. And then when I tell him that, then, he'll make some suggestions and say, okay, go do it. So the next time we meet, I'll give him a feedback on that. But that's really when I started accepting a little more that, counseling is okay. But at the same time, I know that I wasn't the only one going through that. I was a college student the first time I had issues, and then I was in medical school the next time it happened, but I know there are so many of our people going through the same thing who have no one to turn to, who have no place to ask for help. Fortunately for me, I was in medical school, so I had access to one of my professors who I felt comfortable with, and he was able to help me.
And I also have another example, this was actually a real life example. I am in the pediatrics department. We have advisors, so I'm an advisor to one of the residents, and they were having so much problems with him. Then I told one day we meet every week. I'm like, have you done a personality profile to see what you're? Then I told him where to go, the website, where to get his personality profile. Then based on that personality profile, we developed a plan for him. We got him into therapy and everything. And everybody was like, wow. It was like a total turnaround. The guy is gonna be the chief resident now. So sometimes it's just about talking to people and then meeting them where they're at. Because some people feel, oh, why will I be getting my business out there? Why will I be talking to people? Why will I need therapy? In this particular case, it really worked out for this kid.
Yeah. I would imagine that there have been so many issues of not recognizing the lack of knowledge and not recognizing what it is that they're struggling with. In my case, my dad died and I was in Houston at the time, and I didn't have anyone. So I went home, I couldn't cry. I just was numb. And then I came back to the US. About 3 months after that, one day, I couldn't say I went berserk, but I started to weep and I just wept bitterly. I think it was just me kind of really now understanding the magnitude of what happened to me and then just coming off of it. So I will imagine that lack of understanding and lack of recognition of what mental health or even mental wellness or unwellness is also a barrier by itself. Let us talk about how to manage and what to do, because people talk about therapy all the time. Not too many people are comfortable with seeking therapy, especially because of what you just said, Dr. Soyemi. You talked about privacy. Even though you now have telehealth and telemedicine, but most people are not completely satisfied with the fact that it is something that they should be concerned about. So let's have tips as to what they can take home today so that the next time we come, they can at least be ready to hear the next topic.
Whatever what you're going through, somebody has been through it before. Talk to somebody. You ask for advice. You may not necessarily take all the advice, but at least look for somebody, talk to somebody, and ask for advice. And if somebody offers you therapy, consider it.
The advice we are saying, it doesn't necessarily have to be professional advice. Having someone that you can trust and feeling connected, and again, even people will open up. It's just if you have someone that's compassionate, that they know will listen to them and not judge them, people are more likely to open up and talk to them. And I see that a lot in my line of work. Patients that I've never met, and the very first time they are telling me some very deep family issues going on with them. So I believe that just showing compassion and being able to listen goes a very long way. And also having someone that you can trust enough to talk to.
And what I usually tell people is that I'm offering you my personal opinion, not my professional opinion. Or when people come to me for advice, I'm like, do you want me to tell you the truth? Or do you want me to make up stuff for you? Are you asking for my personal opinion? Or are you asking for my professional opinion? Because they're two different things. So it's always good to seek people you trust out. I trust Dr. Fatoki. If I have any issues, I'll text him, hey, Edmond, what do you think about this? And he will send me a message back. So that's the way we should piggyback off each other.
Have somebody that is close to them. Everybody needs a friend that you can trust really well, that you can open your mind to. And as parents, If you see any changes that is unusual in your kid, talk to them without being judgmental. Don't go into the room and start saying, what is wrong with you? Why have you not been coming down to eat? Why are you always sulking? Or why are you... Don't. Go. What's going on, sweetheart? Talk to me. Something is wrong. I don't like the way that I've been seeing you behaving for the last so many days or weeks. What is it? How can I help? Or just reminding them, always remember that I'm here to talk to you anytime you want, day or night. It doesn't matter. I am here to talk, and give them the opportunity to talk without being judgmental, without being too critical, because you're too critical, they're going to shut down. And kids want to talk, but the way the parents respond, all right, okay, that's it. I'm fine. There's nothing wrong with me. And they shut down. So just be mindful. Always keep an open mind and not be judgmental. And remember, mental health is just as important as our physical health.
People can call in anonymously and not be worried about being judged or have their identity revealed to discuss whatever issues they may be going through that they don't feel comfortable talking to anyone about, or that they have nobody that they feel they could trust to talk to about it. So I just want us to put that out, that's one of the reasons why we are doing this.
Thank you so much, Dr. Fatoki, Dr. Soyemi, Dr. Olaleye, and of course our contributors, Mr. Funmi Onayemi and also Mrs. D. Fatoki. We really appreciate your time, and we appreciate the fact that you've been able to share your knowledge. You've been able to give us some level of comfort in terms of discussing mental health. Thank you for joining us on this episode of Healthy Mind, Better Future. Pressures of life can get you down. Don't lose hope. Exercise your mind daily so you can function positively in society for a better future. Continue to join us as we offer tips to navigate your challenges and bring you mental wellness. Your healthy mind is key to your better future. Please subscribe and share our podcast. Someone out there needs encouragement.